But it turned out there was a fellow, his name is Jeremy Parker, and apparently he was a fan of America's Frontline Doctors, and he found his way to our website. And by the way, all of this information took a long time to put together. I did not find out about it in this coherent order. The way I
Mhm.
found out about it was very like piece by piece by piece. But what actually happened was this fellow, Jeremy Parker, was a fan or supportive of Frontline Doctors and had gone to the Frontline Doctors website to learn more about COVID. And on the website, he ends up seeing where if you are interested in hydroxychloroquine or seeing a doctor who's awake, you can go to any one of these telemedicine people, companies, whatever. And apparently he did that. And of course, I would have no knowledge of that. I had no idea. That's what actually happened. So he left our website. We had a screen on our website saying like you're leaving our site, you go into another
Mhm.
site, and then you go to another site. About a year after that article, I think maybe, or a year and a half, America's Frontline Doctors were served with a wrongful death lawsuit that you just mentioned. And the wrongful death lawsuit alleged that the telemedicine doctor who prescribed hydroxychloroquine caused Jeremy Parker's death, and that America's Frontline Doctors, I guess, as a public advocate for this, is also causing the death. Now, oh my gosh, as a lawyer, like my head was exploding. We are most akin to a newspaper, a publishing site. We put out information. How could you possibly say that information we put out is makes us a defendant in what is essentially a medical malpractice case? So that was just erroneous from my perspective as a lawyer. It had nothing to do with it, and we should have been dismissed immediately. Any judge should have looked at this case and said, "Oh my God, this is like a charity that puts out public information. They don't do medicine." I mean, no offense to like the poor level of the judges in this country, but oh my gosh, it's not that hard to distinguish a public charity from a business that's seeing patients.